I'm Dr. Sridhar. I'm a consultant neonatologist and currently I work at Alain Mediclinic. What is the feed pattern in a baby? I already discussed it when I discussed how much to feed, but remember that in the first week when the milk is still establishing, you try to feed as often as the baby needs, every 2 hours or at least 8 feeds in a day. Each feed duration is also not controlled in these situations. After the baby starts feeding well and your milk output has started, you allow the baby to regulate, but make sure you're not over-interpreting the hunger cues. So a reasonable pattern you would expect is between 2 and 5 hours. The older babies can start sleeping longer, but this happens more in formula-fed babies. Breastfeeding babies tend to feed every 2 to 4 hours usually. The duration of each feed again varies, but if the baby starts vomiting after a feed, it may mean that there is overfeeding and you may need to titrate both the frequency of the feeds, allowing some spacing, and the duration of each feed. I mean, if you're feeding for 20-30 minutes after the first week, it may be longer than the baby needs. So you can start shortening it, and some expert babies feed by 5 to 10 minutes, the full feed can be taken. You can also start alternating breasts. So initially you would feed on both breasts at each feed, but once your milk output starts, you alternate the breast so that the baby gets the full milk output. The hind milk is important for the fat and the satiety part and the full nutritional value. The fore milk is watery and rich in lactose. Baby takes it more in the summer for thirst. But in terms of feeding, emptying the breast is important, so you complete the feed and baby may be satisfied with feeding on one breast and alternating. At night, just before you sleep, you can feed on both breasts so the baby gets a little more and sleeps longer.